Welcome back. Joining me now is Dr. Dror Paley from the Paley Orthopedic and Spine Institute. We'll talk more about the Institute in a moment. First, thanks for being here and explain your connection, how you got connected with the marathon.
We got connected, I think, 15 years ago, probably 2 or 3 owners ago from the marathon. And, and we started being part of it year after year. In fact, I think we were their #1 sponsored charity that was involved with them, and we bring all our kids and patients and families out there to run, crutch, walk, scoot, every way of transportation that they can figure out to do the short track. We used to do a 5K. Now I think it's about a mile that we do with the kids, and it's just been a fun thing. Our patients look forward to it every year.
That's wonderful. That must be so rewarding to be part of that and see that.
You know, the fun part is out of the hospital, out of the office, they see us one-on-one as people, not in my scrubs.
No scrubs.
Yeah.
But running shoes.
Running shoes, and it's just fun. It's a day where everyone gets to let their hair down and just really connect with everyone. Everyone wants pictures with their physician, because it's not just me. We now have 25 surgeons at the Institute, and many of them come out. So it's a day we look forward to every year.
You've opened the door to talking more about the Paley Orthopedic and Spine Institute and what you do and how you care for patients. Please explain. People want to know.
Well, I came here 2009 as a solo surgeon. We are now 25 surgeons specializing in every aspect of orthopedics, and very unique group. We're the largest medical tourism group in orthopedics in the world. We get patients from over 110 countries, all 50 states, all coming here to the Palm Beaches to get treatment. And while there's no teaching hospital in Palm Beaches, but they're all professors. They're all people who came from previous, university hospitals, and I kind of stole them away from there. And these are the top of the top in each of their subspecialty areas. What we're best known for is what I started with, which is treating children with disabilities, with deformities, with limb length discrepancies, some of the toughest things that, kids face or are born with, especially birth defects.
What is it like to change their lives as a surgeon?
That's why I leave home with a smile on my face and come home with a smile on my face every day. I mean, it's so rewarding, and it is, I've been doing this for 37, maybe 38 years now, and it never gets old.
I bet it doesn't. Now, I'm sure you've had so many success stories. Can you share one that has stayed with you, that when I say, talk about success, your patients, who comes to mind? What case comes to mind? Anyone in particular?
What comes to mind is 3 kids, all of whom were representing us in the Olympics this year in Paris. So wow. 3 of our children, all born with a condition called congenital femoral deficiency, very rare condition. They're born with their femur, the thigh bone, really short. Their hips and their knees are not normally formed. We reconstructed the hip, the knee, we lengthened their limbs, and they were in 3 separate events at the Paralympics. And it just brought tears to my eyes. I mean, one of them was in archery. One of them was in the shot put, and the other one was a swimmer.
That is fantastic. Just to see that must be, obviously I can see the joy that you have with the work you do and explaining what you've done for patients. These procedures that you developed over, as you said, 30 years, are now used around the country and all over the world, correct?
They are. We've published them. I teach them all over the world. People come here. We run a course every January. We get 100 doctors from all over the world coming just to learn these techniques. And so, we get to touch the lives of not just the patients that come here for treatment, but probably of thousands of nameless patients indirectly through the people that we teach these techniques to.
And you stay connected to these patients, I'm sure, because obviously the personal connection I can see that you feel.
You become part of their family. You get invited to graduations, bar mitzvahs, weddings, and on and on and on. I just had a patient of mine. I see patients on Mondays. I saw a patient on Monday. She's 50 years old. I treated her as a kid.
Wow.
Okay, and she's been doing great for many years. She's married, has kids. I last saw her at her wedding, by the way, and she came back this week because she's having some knee pain, and they don't trust anyone else. So even like I don't do joint replacement, for example. I have partners who do that, and she came to me. She probably will need a joint replacement. She came to me and said, "What do I do with this knee?" And the trust that we've got with these patients, it's a lifelong connection. And that's why it's a really special practice. I've truly been privileged to be able to do this for the last 37 years.
Well, on behalf of all your patients and future patients, thank you, Dr. Dror Paley. We appreciate it.
Thank you.
All right, thanks for joining us.
Pleasure.
On the record.